Welcome to the State of Health. I'm your host, Karen Bowling, Cabinet Secretary of the West Virginia Department of Health and Human Resources. In today's show, we're going to speak with U.S. Attorney Booth Goodwin on a program designed to keep children safe called Handle with Care. Then we will take a look at the need for foster families and children needing adopted into loving homes, plus hear from a parent who has adopted 2 children. A recent national survey found that 60% of American children have been exposed to violence, crime, or abuse in their homes, schools, or communities, and that 40% were direct victims of 2 or more violent acts. Joining me now to tell us more about Handle with Care is U.S. Attorney Booth Goodwin. Thank you so much for being here, Booth.
It's such a pleasure to be here on this very important topic.
I know that there is a huge problem, and there's been a national survey on children's exposure to violence. Can you tell our viewers a little bit about that?
Right, as you talked about just right at the top of the show, it is an incredible problem. I mean, 60% of our kids exposed to abuse, really trauma in the home or in their communities or in their schools, and 40% a direct victim of 2 or more violent acts. Those numbers are staggering, and it shows why we have to be so committed to identifying those kids who have been exposed to trauma and intervening early and effectively.
Now, when we talk about exposure to trauma, how does that impact children?
Well, I mean, it affects them at their very core. I recently read a book called Brain Rules. It's by a neurological molecular biologist, but I mean, it's really a good read, and it talks about how stressed brains don't learn in the same way. And when you're exposed to trauma, it dangerously deregulates a system that is really designed only for an immediate response to a passing danger. But these kids in a chronically stressful environment, that dangerously deregulates their system, and it affects their ability to learn and remember. It affects their mood, their quantitative reasoning, a whole host of things. And you know, it starts to exhibit as other issues that they have. And when all we really need to do is get to the root of the problem, get to the nub of the issue.
Absolutely. You know, we work in partnership with your Handle with Care program, and it's really heartwarming to me to see how we're all working together to help our children in the state. Can you tell our viewers about Handle with Care?
Sure. The idea, as I said, is to identify these kids who have been exposed to trauma. And that's not just one person or one entity. It really takes the entire community. But the most logical place to find these kids who have been exposed to trauma is when a law enforcement officer responds to a call, whether that be a domestic violence call or a drug raid, what have you. What they do is they note the presence of the child, their name, their age, their address, and where they go to school. The law enforcement officer gets that information up in the police department and forwarded over to the school before that child hits the door the next morning. What that does at the school then is alert that school, the folks there on the ground, the teachers, principals, all the way to the custodians and the cooks, to handle that child with care. Just 3 simple words can make the difference between how they're dealt with during the day. So, and when they have that information, they can intervene early and effectively in helping that child work through the trauma.
And I think that's so important. I think that this collaborative approach, police officers, school personnel, people from our department in the DHHR, right, all of us have to think about and understand what's happened to that child and what impact it's having on the child and how we can support the child and help the child. Let's talk a little bit about on-site mental health services at schools. Sure. I know that's something that you've advocated. We also provide some funding for that through the DHHR. Why is that important?
Well, you know, what is the common thread that runs through kids through this is the school. I mean, kids go to school, and that's the most logical place for us to intervene. And if we don't intervene there, then they're going to end up beating me later on down the line.
Right.
Or they're just not going to be successful in life. And in order to intervene, we've got to have the services available there on site. And the pilot school for this project was Mary C. Snow Elementary over on Charleston's west side. And at Mary Snow now, there is an on-site mental health clinic where children, more than 100 so far, have been provided with on-site mental health treatment there at the school, both through this identifying process called Handle with Care and referrals from parents. And it's made a remarkable difference for the kids and really helped them achieve at a much greater level than they ever thought possible.
And we need to help our children be successful. I mean, that's so important in this partnership that we have to do that. Now, let's talk a little bit about your interest in this. You know, I've been so impressed, I will tell you, that, you know, your enthusiasm and how you feel about children and how, as a federal prosecutor, you've been involved in this project. Right. Can you talk to me a little bit about that?
Well, I come at this a little bit different way. As you know, I'm the father of 2 young boys. My wife and I are extremely blessed to have 2 little guys. Well, they're not so little anymore. They're 11 and 13. And that shapes the way I do my job. And what I've seen is that we can't just be prosecuting at the end of the day. We've got to be doing every bit as much to prevent crime from happening in the first place. And we've got to intervene early if we're going to do that. You know, we talked to a group of inmates at the Federal Correctional Institution down in Beckley, and we asked them, when would it have been that we would have had to intervene in your life? And we thought it would be early. We had no idea. They said sometime between 7 and 9 years old.
Wow.
That's when they needed their intervention. How do you identify those kids early enough to intervene effectively? And I think Handle with Care does that. But at base, it has to be all of us working together. And that's why I've so appreciated the foresight of the DHHR, your folks at the Bureau for Children and Family, Nancy Exline, and really having that vision to bring people together.
We have to change the vision. You know, we have to reform the system, and it does take all of us to do that. Now, in that same vein, I know you're expanding Handle with Care. I was there in an event where
Right.
you know, you had your pilot,
right.
and now you're moving on. Tell
right.
me about how that's going to work.
Well, again, with funding from the DHHR, or through the DHHR, we've stood up a Center for Children's Justice underneath the state police, their professional development center. And what it is to do is to provide the training necessary for law enforcement, for educators, mental health professionals, school nurses, counselors, everybody involved in the process to expand this on a site-by-site basis. It's going to take people, it's going to take commitment, but we needed a central repository and a central place to push this out, and the center is going to provide that. Andrea Dar is our center director, and if people want to duplicate this in their community, please reach out to Andrea at the Center for Children's Justice. I mean, it's a great place.
Is there opportunity to expand it to other communities now? Are we? Is it in the process? You're ready to go.
We're ready to go. I was there yesterday, and you know we're talking about pushing it out as fast as we can. But it takes people, and it takes commitment. And if people want to do it, we want to hear from them. I really hope that we'll get a lot of calls.
Well, we have the number, I hope, up on the screen so that you know, people will give you a call. We're in partnership with you on this. Anything that we can do to help children. And I'm very grateful for that partnership. And I look forward to Handle with Care expanding across the state, just as we plan to do other initiatives to help children. Because the reality is, for children to be successful, we have to all be in this together to support them. And I appreciate your support. So thank you so much, Booth, for being on the show with me. And I hope that you'll come back again and tell us in a few months how we have expanded Handle with Care.
I love that. Thank you so much.
Thank you. When we come back, we will talk about what West Virginia is doing to help children get adopted, and later talk with someone who adopted not 1, but 2 children. Stay with us.